Oh my gosh.
And I had a breast cancer patient in 2016 who had an implant-based reconstruction who wanted a flat procedure. And so for the audience, you can have breast reconstruction using tissue expanders and implants. You can have the technique I talked about using your own tissue. And of course, you can have an aesthetic flat procedure, which is more common now. And so I had done those over the course of my career at request. And I did her workup, went through all of her laboratory analysis, all of her studies. She didn't have any history of radiation. She had underwent chemotherapy, which obviously a lot of patients are getting that during cancer treatment. And she had fatigue, and that was always kind of considered secondary to her chemotherapy treatment because it causes bone marrow suppression. That's a pretty common problem. Nothing else. And then I did her explant. I did all the capsule removal at that point, intact, which was basically my practice that we did for reconstructive purposes anyway. We always test everything and check the pocket. We do cultures. And she had an E. coli infection.
Oh my gosh.
So that was a very odd thing that I didn't quite understood. Because still can't figure out kind of how that was going on and not making her more ill. So her big symptom was fatigue. And once I got that information back and put her on just basic antibiotic therapy based on those culture results, all of her fatigue went away. So she'd been had this for I don't know how long.